some statistics and things like that that'll help you understand a little bit about what I'm going to share tonight. And if you're not able to do that, I'll make some slides of this, and we can see this tomorrow. You can pick those up and look at them and see where we're at with that. I'm sorry about that. We thought we had it worked out, but obviously we didn't have it worked out. So anyway, I am glad to be here tonight. I want to talk to you a little bit about COVID and the Atherton campus, and I also want to talk to you a little bit about where Atherton is going to go in 2021. So since I last talked to you, which was at the end of November, so much has changed, not only around the campus here, but in the United States related to COVID, all of the things we've had to deal with, and Atherton has gotten caught up in all of that. Much of the news is not good news, and we've been coping for the last now 5 weeks with a surge that's come to Atherton too. And so I just want to kind of give you an idea about that. Then I want to talk a little bit about the vaccine. Several people have questions about the vaccine, and so I'm going to try and answer those. The one thing is, I have my phone here. If you want to text a question to 559-824-2721, or if you want to send an email question to cstaton@abh.org, I'll be happy to pick those up as we get towards the end and try and answer all your questions if we haven't gotten anything. So that's kind of there. So let me talk to you a little bit about COVID. About 4 weeks ago, about the middle of November, I looked at the management team and said, it feels like it's all COVID all the time. Little did I know it got worse. It was going to be more COVID all the time at Atherton, and it has, we've spent a tremendous amount of energy just dealing with that issue. So as I said before, a surge in the coronavirus in California after Thanksgiving created a surge at Atherton. From March 15th, when we did the shutdown, till November 30th, Atherton had a total of 30 cases of COVID. 2 of those were with residents and 28 were staff. And when I began to look at other organizations and everything, I began to feel pretty good about how Atherton had managed and handled this. We had gotten some things in place. We felt like that we were managing very well. Everything was going well. I was frustrated that we'd get 1 or 2 positive cases every time we did a test, which would cause us to have to do a variety of protocols to follow through and make sure that other people didn't. But little did I know that this was going to be much more challenging down the road. So from December 1st to December 31st, Atherton had a total of 64 cases in those 31 days from staff and residents. And since January 1st to the 12th, Atherton's had a total of 38 cases. So what has happened all throughout Southern California came to Atherton in abundance. And all of the things that we thought were in place that would work really well didn't work as well as we'd hoped. And I'm going to talk to you a little bit about why I think that happened and what's going on and why it's really important for us, the things that we just regularly do about this particular coronavirus. I've said to some of my staff, I said, And I do not know to this day why some people get really sick, why some people do not get sick at all, and why some people are very mild. I don't have any idea about that. I do know, though, that when it comes, you don't know what's going to happen and how it's going to work. Here's the other thing that I have learned about the coronavirus. Most people recover. The problem is that in a skilled nursing facility where people are considerably elderly and have significant preconditions, adding coronavirus to that can result in the end of life. And that's why the majority of deaths across the United States and across the world related to coronavirus are in senior adults with pre-existing conditions. And that's just the reality of what you're dealing with. And so as a result, as you see, Atherton has had now 122 cases of coronavirus. 75 of those have been among the staff, and 47 have been among the residents. And what I wanted to show you is, you can see that it has come to all departments of Atherton. 23 CNAs, 4 LVNs, 18 caregivers in assisted living, 2 people on maintenance and ground staff. There's only 8 people on the staff. 13 in dining services, 5 in the administration upstairs, 7 housekeepers, 2 in laundry. There's 4 people in laundry. And 1 in activities. There's only 3 activities people. And here's the other thing that's interesting. 4 people have tested positive twice. They tested positive in March, or they tested positive in August, or they tested positive in September, and they've tested positive again in December. All 4 of them, I believe, were asymptomatic the first time. They didn't have any kind of symptoms or anything. The second time they got pretty sick. Not overwhelming. All of them have recovered. But we have had people now, 4 people who have tested positive twice. So theoretically, I could take out 4 of these and just call it 71. But you can see it's every place. And it's come in. And I'm going to talk a little bit about why I think that happened. It's not because these people don't care. They do care deeply. But they're doing other things in their life, and because there's so much coronavirus around now, they keep running into places. Then we've had 47 cases. And as you can see here, 37 of those have been in skilled nursing, 8 have been in assisted living, and 2 have been in independent living. And that's all the way across the United States, by the way. People who live in individual settings have less opportunity to get the virus than people that live in closer community settings. So the danger in skilled nursing is greater just because it's closer communion. People are together. They interact more. The care and the service is more personal. It leads to more dangerous kinds. It leads to more difficulty in those kinds of situations. Those people are there because they need that care. And the people who care for them are willing to do that care. And it's hard work. It's difficult. But it requires an interaction that the virus is very unforgiving towards. And that's the challenge that's there. So 75 cases in the staff, 47 in the residents and skilled nursing, 122 cases so far at Atherton. I used to think that Atherton was a shining star. I still think Atherton's a great place. But where this kind of result is every place in LA County. It's every skilled nursing. It's every place. The best ones that I've seen are the communities that have skilled nursings with only about 25 to 35 beds. And so they're so much smaller, and they still have cases. There's a nursing home not too far from us, Monte Vista Grove. It has 35 beds. They've had 17 cases. So it's just, this is the reality of what's going on here. In addition to that, 122 cases, 75 of the staff, 4 tested positive twice. 5 are recovered and back to work. Or 58, I'm sorry. 58 are recovered and back to work. 17 are still ill, but it's been less than 14 days. So they're recovering. At the end of 14 days, most people come back to work. 2 have been hospitalized. None of the staff has died. Okay? We have staff members who have lost family members. We have staff members who are grieving because they've lost loved ones. So that has been a part of this. But of these 75, most are recovered and back to work. They are not feeling the effects of long-term consequences. I've heard nothing about that. These 17 that are still ill, I would assume will recover. There are 2 have been hospitalized. One of them has been gone 3 months. I think he will be back, but he's been in and out of the hospital. It's been a very difficult road for him. And one other was in the hospital, came out. I expect her to come back after probably about 6 weeks. So that. We've had 47 cases of the residents. You've kind of seen this. 37 in skilled nursing. So I'm going to go from the bottom to the top because the news is better at the bottom going up. We've had 2 residents now in independent living that have tested positive. Both of them has recovered. One of them went to the hospital, the other did not. They seem to be doing well. And one went to the hospital, came out, is feeling much better, has made significant progress. It's been a full month in that. There's 8 in assisted living that have tested positive. 6 of those have recovered. 1 is still ill, and 1 person in skilled nursing that had pre-existing conditions passed away. He had actually ended up going into the hospital, came back to the Atherton skilled nursing for care and treatment, and never was able to recover and get strong enough to go on living. Of the 37 in skilled nursing, 14 have recovered. 13 are still ill and in what we call our COVID area. And 10 residents have died being COVID positive. Now, this is the way that I talk about this. COVID was one of the issues that created a problem for them, and as a result of that, they died. All of the people that have ever been in skilled nursing end up dying. That's a part of life. And we actually have somewhere between 35 and 40 people that die in skilled nursing every single year. Now, people don't die because they go into skilled nursing, but they have a range of problems that they need help with. And sometimes they go in, they recover, they come right back out, they do that. Sometimes they go in and they're custodial and we care for them and they do that, but the conditions and all the things end up ending their life. That happens. That happens to everybody. COVID was, when you add COVID into people that already have those kinds of conditions, it creates other problems. And as a result of that, 10 of those have died. And so there probably will be some others. The last 2 months have been very difficult. Up to this point, Atherton had actually lost less people in skilled nursing this year than it had in the past years. But with this, and we're not significantly ahead. It's caught us up. But that's a part of that. So that And I don't have the rhyme or reason about why some have died and some have recovered, other than the pre-existing conditions. 2 that have recovered are over 100 years old. I have no idea why they were able to navigate that and do that. I don't know. So, but that's, anyway, so that's the situation that we have struggled with. What is hard for the staff at Atherton? We are used to dealing with death. Our nurses are used to dealing with death in skilled nursing. What is very difficult is it doesn't come quite as quickly as it's come in this particular case, and you don't feel such personal responsibility because of all of this. Because some of them got sick. And what we know is this brought this. It brought, the staff brought this in. We've been keeping people out of skilled nursing. We've been monitoring visitation. We've been doing all of that. It had to come from someplace. It didn't come from the residents. It came in from the outside. And we've struggled with that. And that's what's really hard about that. So let me tell you why I think that all this happened. Why did Atherton have this surge of cases? Well, the first thing is there were more cases in Southern California. So there's a lot more virus around. When there wasn't as much virus around, you could pick off 1 or 2 people that had it. And the great thing about the testing, and we actually found a great company to test with, and we were testing on a regular basis. And so we could catch things early and keep it out and do those kinds of things. But when you have a lot more people that are having it and they're running into it a lot more, it makes it a lot more difficult. Second thing, asymptomatic spread. The reason in December that the COVID virus came into Atherton initially was because of people that were asymptomatic. They came to work. They had their temperature taken. They had a range of questions. Their temperatures were fine. They were fine. They went to work, but they were positive, and they didn't know it. And we didn't know it because we didn't test everybody every single day. We don't do that. We don't have the wherewithal to do all of that. Can't get the testing to do that. We can't get the results back quick enough. We can't understand its reliability. So all of that was just a part of that. Is this what's called asymptomatic spread. And that's why when you go to the grocery store, you probably have run into somebody that has COVID. Or you go to a store and you have probably run into somebody, they don't know it and you don't know it because nobody has a sign. It's just the reality of it. And it's asymptomatic and it's all over the place. And that's the problem. The third thing is families, as a result of Thanksgiving and Christmas and all of this season, spread the virus. So we tend to think that because our family members are not sick and they go to work and they go out and they do this and that, and then when we all get together, we tend to think that we're all safe because we all say that we're safe. And so what we do is when we go into our homes, we take off our masks, we hug our loved ones, we care for them. We do all of those things. And that is where the spread is most easy. Many of our families that live and work at Atherton live in multi-generational homes. Mom, dad, children, older folks, grandchildren, grandparents, they live in multi-generational homes. The kids go out and they do what they do. And people in Southern California got very tired of wearing masks, of not being able to go out to restaurants. We're a pretty mobile society in Southern California. We like our entertainment. We like to do stuff. You've seen all the stuff on the TV about people complaining about they can't go out to eat, or, and the economic distress was there. And all of a sudden, that stirred up and spread all the virus around, and then we brought it home to families, and boom. That's when it spread really fast because we don't use the tools that we have, masks, we don't wash our hands all the time, we don't social distance when we're in that environment. That's just not the way that we live. But that's a feeding ground for the virus. Fourth, we got lax on the use of masks, hand washing, sanitizer, and social distancing. I've already said that in the family, we don't really do that. But I don't know how many Athertonians I've seen who wear their masks on a regular basis, and they wear it down like this because they want to breathe better, and then they take their hand and put it up here like this, and then they don't wash their hands. If you have the virus, it goes into the mask when you breathe. If you take your hands and touch the mask, it can be transferred from your mask to your hand. And you walk out and go touch this or go touch the door or touch other things, then the virus is all of a sudden there. Think about this when you go into your home. All of that there. You don't think about any of this. We just do this because there's now a lot more virus around. The way that we do these kinds of things becomes significantly important. And I'll say this again. If you make a mistake, the virus does not care. It then goes to other places. We all got a little lax. In these kinds of things, we didn't wash our hands as much. We didn't use the sanitizer as much. We just assumed that all of our family members, our loved ones, the people we love are fine. We're wearing masks now. We may feel comfortable or uncomfortable with that, but we adjust it all the time. You see what I just did? What I need to do now is wash my hands. We're all assuming that I'm negative, aren't we? But what if I was positive? We don't know. That's the problem that's the situation that we're in right now. And that's the challenge. And one last thing. There's a unique setting in skilled nursing where residents do not wear masks or social distance, and staff is providing very personal care. The residents of skilled nursing, we're not asking to wear masks because they can't keep them on. Some of them have issues of dementia, other kinds of issues. Some of them have poor breathing, those kinds of things. And so putting a mask on is very restrictive to them. It's scary for them. And so we don't ask them to do that. But when we ask them to do that, we're doing the same thing that you're doing in your house. There's no barrier between them. And the care that the nurses are giving is very personal care. And some of them can't hear. And so you get close down to their ears to talk to them, and you're all of a sudden very close to them. There's a whole range of things that are going on. And that's what makes skilled nursing so difficult with this particular virus. And if you let down for a second, that's what happened. And that's why Atherton has had this surge. It's because of all these things working together. And it's not Atherton, it's not just Atherton, it's Southern California and its families and its hospitals. And the tragedy, the challenge for Atherton and the challenge for all of us is that now there's such a surge in the hospitals across Southern California that if you get real sick, they don't know where to take you and when to take you. We've had some of our staff, we've had some of our residents and employees who have sat in ICU rooms for 3 days before they got a bed. It's not a good situation. And it's not going to get a lot better faster. It will get better, but it's not going to get better faster. Okay? So, That's pretty gloomy. I've just been fairly gloomy, but that's the reality of where we're at. Okay. So here's the next thing. And I use this illustration later. Remember that when we started this back in March and in April and in May and June when I talked, I said we had not even arrived at the beginning. I said when we shut down, we weren't even really at the beginning yet. We had a long way to go. We weren't at the end of the beginning. We were just at the beginning of the beginning. So I will tell you, when the vaccine arrived and actually began to be, it was proven and said, I believe that that was the beginning of the turn. And if I can use another World War II analogy for you, I believe we've now hit D-Day. We're now coming on the beach. And the end is in sight, but there's a lot of work to be done. We still have to go through France, Belgium, all the way into Germany. There's going to be more people that lose their lives. It's going to be very difficult. But we're started towards the end. It'll take all year for us to do this, folks. It's going to get better and better and better, but it's going to be all year. And you're probably wearing masks all the way through 2021. But you will get to see your grandchildren. And you probably will get to hug them. And you will get to laugh and enjoy them. You might have a mask on, but you will get to do all of these things this year that you've been missing. We're moving towards that direction. But it's going to take a while. It still is going to take a while. I can't remember how long it took them through to get finally to the end of the war from D-Day, but it was a good amount of time. 1 year. So if we're at D-Day, we've still got a full year of this. Okay? But the vaccine is the thing that helps us. So Atherton is really quite lucky, and it's because of a lot of really good work by Mary Monnier and Angela Lee that got the right calls made to the right people at the right time. We aren't luckier than anybody else. We just tried to understand and make sure that we submitted our names at the appropriate time. All of the vaccine was predetermined by LA County. So it's not like that we got to the head of the line or anything. We just submitted our name. When they said, are you interested? We said yes, and all of a sudden here we are. Okay? LA County, in terms of skilled nursing, decided to pull out of the government program and distribute the Moderna vaccine directly to nursing homes for them to do the inoculation of their residents. And they called us and said, we have your vaccine, and we said, fine, we'll take it. And we got it. And that was on the 30th of December. The Pfizer vaccine, we submitted our name, and all of a sudden CVS called and said, we're setting up appointments, and we said, we're ready. And they said, how many do you need? We said, we need 350. And they said, can you do this date? We can do it. And we have started that and done that. So in December 30th, we vaccinated 70 of our skilled nursing staff with the Moderna vaccine. On January 6th and 7th, remember that they released the vaccine the day before New Year's Day and a weekend. So it made it real tricky to get everybody in place to get all of this done. And that's why it took us a little bit longer to begin to do the residents. Plus, you've had many of them who have recovered and also were sick. And so you can't give them the vaccine. So that's the reason why there's 40 of those. We will do more of those in this week, but that's where that's at. And then in these 3 days, we're going to vaccinate over 300 staff and residents with the Pfizer vaccine. So I had thought that the Pfizer vaccine wouldn't come to the independent living residents until sometime in February. I was sure that you would all get it by the 1st of March, or by the end of the first quarter. Boy, was I wrong. I only missed it by 2 months. And boy, am I thankful I was wrong. So we've done a lot of that. So here's the thing, a couple things you need to know. So the vaccines, both of these vaccines, Moderna and Pfizer, are most effective if you get a second dose. Now there is some research that says that they're about 50% effective if you get one shot. And so that kind of immunity grows over time. So you've heard these stories about people getting a shot and then they test positive. Yes, because your body hasn't built up those immunities. So just because you got the shot doesn't mean that you have the immunity. In the case of the Moderna vaccine, you need a second shot after 28 days. It doesn't have to be right on the 28th day, and you actually can do it a couple days before, and you can do it a couple days after. It's not going to change anything like that, but you need a second shot. And that moves it from about a 50% effectiveness to a 95% effectiveness. If you get the Moderna vaccine with the second shot, can you still get the coronavirus? Yes, because it's 95% effective. They're not saying it's 100% effective. It's better than not having it. It gives you more if you build up antibodies to fight the disease, but that doesn't mean that nobody's going to get it. And that's why we're going to have to continue these protocols, because it doesn't mean that I'm Superman now. I have some immunity. And what we still don't know, the research has still not told us, I could get the virus and be able to give the virus without getting sick from the virus. We still don't know how all that works. So you could get it, give it to someone who has never had the vaccine, they could get very sick, you could be fine. So there's still a lot. The Pfizer vaccine, you get the shot 21 days after the first dose. So most of us, from the Moderna to the Pfizer around here, the first part of February, we're going to be doing this all over again and getting these shots, to let you know. Again, both vaccines create about 95% immunity. Both of them are similar in that. If you did not get the first dose this week, in other words, you didn't get signed up or you weren't quite sure whether you wanted to get the vaccine, you can get the first dose when when the people who signed up get their second dose, and they will come back and do a third trip where you can get your second dose. So if you decide, I want to get this, I want to get the vaccine, and you haven't signed up yet, don't worry, you'll be able to sign up and get it again. We will still be wearing masks, washing hands, and practicing social distancing after we get the vaccine. I will encourage you to do that in all of your daily life. I will demand that we all do it around Atherton. It's not going away. What I'm hoping is that at the end of February, after these immunities have kind of built, and we have a good amount of this, that we can resume some of the social activities, provided we wear masks, wash our hands, and social distance, like having a few more people come to the chapel for chapel, like having outdoor dinners again, like doing some of these kinds of things, trying to create some things around Atherton to enhance the community and do those kinds of things. Because we've added another tool that will help to keep us all safe. But I can't guarantee you that I do not know that everyone at Atherton is going to get the vaccine. There are some people who have said they will not because they have other kinds of issues. There are some people that are waiting because they're not quite sure. There's a whole range of things here. And so we still have to practice this. Lastly, we've only heard of some minor reactions from the first dose of the vaccine. People have sore shoulders. When I got mine, I did not get sick. I didn't have other issues going on. I just said, please don't punch me in the arm. This is not the day to do this. And it was about 3 days. And I'm not all fond of being punched in the arm. But that's the thing that we've heard. That's the primary thing. When we first did this, we had one of our nurses whose blood pressure spiked a little bit. She actually called her doctor about this. She had a predisposition towards high blood pressure. The doctor said nothing about it. After 24 hours, they were fine. So it's, we don't know. We have heard stories about them being, the reaction at the second shot being a little bit more. And so we will watch that and see that. But we will see that. But that's kind of where we're at with those vaccinations. Okay. Oops. Wrong way. Well, I don't know where I'm at now. There we go. Okay. Oh, shoot. All right. Yeah. There we go. All right. There we go. Okay. So those are the two big sections that I wanted to talk about tonight about the coronavirus. I have a couple of questions here that people have asked, so let me see if I can take those on, and then I'll check my phone for other things. One says, a couple of residents had the vaccine yesterday, and one has soreness in the arm and the other shoulder blade. How long does the soreness last? Well, I can only tell you that for me it lasted 2 or 3 days, and it wasn't severe. It was not. I could raise my arm. I didn't have any problem with that. So I have a couple people here who also took the vaccine yesterday. So Neil, how long did it take you? So Neil Fry said he hasn't had any problems. Patty, did you have any soreness? Okay, so Patty Fry says her arm was sore. She's not had any problems whatsoever. Yes, ma'am. Oh, okay. So there was one who had to pay attention about laying on the arm. So those are just the stuff that we've heard. Nothing about that. So, I think 2 or 3 days soreness. Again, I had this same reaction when I did the flu shot this year. My muscle was sore. So wasn't any different this step. Number 2, after receiving the vaccine, can you still become infectious, even though we do not have symptoms? Can we pass the virus on to others, like our grandchildren? And the answer is yes. Yes. Even when you have both doses, you're only 95%. You could be part of the very special 5%. Okay? This is one time when you don't want to be in the 5%, but it's there. And they still don't know whether you will be able to pass this along to others. They still don't know that. And so I haven't found anything out about that yet. So could you pass it on to your grandchildren if you have the virus and not get sick? The possibility is yes. And so you need to be aware and take care about what you do with that. Number 3, the new guidelines for vaccinations just coming out this morning at the federal and the state level. What assurance do we have that there is a sufficient supply for the second dose of the vaccine, whether Pfizer or Moderna? Well, for Moderna, I would say I have pretty solid guidelines because I have it in the refrigerator. Okay, and I don't plan to give it to other I don't plan to give it. I know when it's committed to and that it'll be good to, and so we just plan to do that. For the Pfizer, we are working with the federal program, and they have committed to this. And so I am assuming it's all going to be fine. We have scheduled the dates, February 1st, 2nd, 3rd, I believe those are the exact dates for you to come back and do that. So I am pretty assured that there will be the second dose. I'm not as worried about that as some other people are. We will see. Number 4, the Pfizer vaccine requires a very complicated time and temperature handling procedure during transport and a vaccine sites. How is CVS approaching this? The person did not observe CVS using special containers for the vaccine vials in the chapel while on campus thus far. And you wouldn't. The Pfizer vaccine has to be shipped at a very low temperature, but they don't put it in your arm at a very low temperature. It warms up. Now, the one thing that we know about that is they only warm up what they need so they can do that. And so they're not trying to keep this at a very low temperature. They're trying to bring this up to a normal temperature when they're around here with us. That's the whole idea behind what they're doing. So and the reason that the federal government went with CVS is because they have the ability to manage these kinds of things. And number 5, how is CVS assuring the privacy of the data on the forms we submit, both in paper copies and its computer link to the state computer system? And the answer is, I do not know. I do not know. I know they are gathering a tremendous amount of data out of this. And I do not know how they are securing that. So I can't tell you that piece of information. So at this point, I have no there. Yeah. Okay. Okay. So Patty Fry is here tonight, and she said to me that she has a question about if somebody tests positive, a staff or a resident, what are the protocols so that you inform other people so that they can remain safe and they can be tested? So the company that we're using now that does all of our testing, or what we call our PCR testing, which is the most sophisticated of the testing. So they upload all of the test results online. And all of those test results come to me. And so after we submit tests, anywhere from 24 to 48 hours, I begin to start looking for those test results. And they've been very good to us about getting us results between 24 and 48 hours to do that. And so I start looking for those results. Once I get those results, I check them, I go through, and then I will send that information to either Mary Monnier on skilled nursing or Angela Lee on assisted living, independent living. They are the two conduits for that information. And I let them know who they are. It's also, if it's a housekeeper, I call Maggie Garcia. If it's a grounds person, I would call Maggie. If it's a dining services person, I would call Mel Perez, who's a part of that. So I call department heads. If it's on assisted living, a staff person, I would also call Lisa Renee Alvarado. So all of that information gets disseminated to them. And they immediately find out if it's an employee, if that employee is working. And we, first of all, tell that employee that they have tested positive, and we take them off. So they immediately go home. And you've got it. When you hear those words, it's pretty traumatic. You've tested positive because there's all sorts of images. So we try and do really good care for these people to let them know, no, we're with them, we're going to stay with you, but you can't continue to work. And then we begin to do an assessment. We look at what area were they serving and who did they come in contact with, and we also ask them, who did you have contact with from 48 hours before you tested positive? Okay, we go back 48 hours. Now that's based upon what the CDC has told us and what the LA Department of Public Health. So I don't go back 72, I just go back 48 based upon that service, and we begin to look and talk to those people and find out who those contacts are. And then we will begin to call those people. If they're staff people that we're working with, then we will talk to them, and then we will tell them that we want to get them tested to see if there's any kinds of things happening about them. We basically are doing what's called contract tracing within our organization. If it's residents, then what we are doing is we're contacting those residents and we're saying you've had contact with a person who's tested positive and we'd like to come and we'd like to test you. Now, when we originally did this back in April and May, it took almost 6 days for us to get the result back. And some of the residents just got really upset with us because you're telling me I have to quarantine for those 6 days. Yes. And that's still true now. We ask people to, we're going to come, we're going to test you, we'd like you to stay in your unit because you are now a person under investigation. It's not anything that you did wrong, it just happened. But if you test positive, then you could have been a person who spreads this to other people. And that's why we're asking you to sit tight for a little bit. We get these results in between 24 and 48 hours. We will let you know. As a whole, we've only had one incident where a person tested positive and actually gave it to a resident. That's one of the two. Only one person in this whole time that we've been doing this of an independent living resident. Now, it's happened more in assisted living and in skilled nursing, and that has everything to do with the personal care that you're talking about. But, so we go through that and check upon that. If a resident then would test positive, we immediately let their family know and their doctor know. And they call their doctor. If you're an independent living resident, so if you want us, we'll talk to your family, but as a whole, as an independent living resident, you're the one that usually talks to your family about this kind of thing. So we encourage you, call your family, let them know, call your doctor, talk to him about this. He's going to ask you how you're feeling, what you're doing, all those kinds of things. And you're going to spend some time in quarantine now. And if you get, and we're going to monitor regular. We're going to try and see what's going to happen, what your prognosis is. Again, as you've read before, most people get better. It comes in different ways for different people. Some people it's a light cold. Some people it's a very heavy cold. Some people it's overwhelming. Some people go to the hospital. We haven't had much of that with independent living residents and assisted living residents. Most of them, they get better over time. But we watch, we monitor, and doctors use a variety of secondary drugs and antibiotics to monitor infections and kind of go through that. So that's usually the way this plays itself out. Patty, do you think I answered that question? So Patty's saying, summary, if I was exposed to somebody who was positive, I should know in about 48 hours whether I'm positive or not. And as a rule, that is a true statement. As a rule, that is a true statement. There are times when we don't get everything done in the proper way that we wanted to do. Over the holidays, we missed some stuff just simply because people were going and coming. But as a whole, yes, I think that you can, if a person tested positive that you had contact with within 48 hours, you should know. Now, I will say this. We have had people who have tested negative twice and then tested positive. And so the incubation period is not just 24 or 48 hours. You may have contact, you may have the virus, and it may be 5 days before you actually test positive. You still have to, if you have contact, you still have to monitor yourself. And you need to consider yourself, even if you test negative, up to about 10 days, there's a possibility it could grow into an illness. And so you need to be aware when you go out. You got to wear your mask properly. You got to wash your hands and do all those kinds of things. You probably ought to social distance with everybody you're around. You just need to take that very seriously about this. After about 10 days, the virus, it's very seldom that the virus gets strong enough to create illness after 10 days. And after 14 days, the CDC and the Department of Public Health says that you are clear. Okay? Now, we're using protocols now for our staff because we've had so many in and out. If a staff person tests positive but they're asymptomatic, they don't have symptoms, they can come back to work after 7 days if they test negative, or they can come back to work after 10 days. But if they have symptoms, if they're symptomatic, they have to wait till 14 days. And so those are the protocols that we're using. But as most of the stuff I've read said, after 10 days, there's less of a chance of you. And the longer that you go and are not sick, from 2 to 3 to 5 to 7 to 9, the better chance you have of being healthy and avoiding the illness of the virus. Okay? Yes, Dan? Have we heard anything about this new strain? Okay. So Dan Shaw is asking because across the world, there have now become different strains of the virus. It's like any other virus. Most of us get a flu shot every year. Why do we get a flu shot every year? Why doesn't a flu shot just take care of all flu? Because the flu, the virus, mutates. That's the nature of it. This virus is mutating. It's changing. And so what scientists are concerned about is it mutating in a way that it's going to be more infectious, less infectious? Is it going to be more dangerous? Are people going to get more sick, less sick? What's going to happen with that? Will the vaccine stop the mutations? I'm going to get vaccinated, but is it going to stop it? And all of that kind of information we do not know a lot about at this point. There is speculation that some of these vaccines will in fact stop these mutations, but there's not enough information to know. As of present, I have not heard anything in the San Gabriel Valley or anything, to tell you the truth, in LA about any of the mutations. And I have no idea. Our lab is certainly not checking for the mutations. I can tell you that. That's not what they're doing. But I haven't heard of that. Having said that, it's in Southern California. It's a virus mutation, and it spreads, and they will find it. But I don't know how to deal with that other than to say we're going to continue to do what we're doing. We're going to ask you to continue to do what you're doing. And that's about the only thing we have now. We'll see whether the vaccine is able to help us with that. Okay. All right. Oh, I'm way over, aren't I? I'm a Baptist minister. Okay. Thank you. So, real quick, these are the things in 2021, and I'm going to do this in less than 2 minutes. But this is what's coming in 2021. Number one, we're going to deal with and recover from the pandemic, D-Day. That's what we're going to do in 2021. We're going to deal with and recover from. And all of us are going to do that. Second thing, we're going to renew our connections with one another. Did you know that there are 26 people that have come to Atherton during COVID? Most of us don't know who they are. We're not even sure what they look like because they're wearing a mask all the time. I've met most of them. I haven't met all of them. All of them seem to be absolutely wonderful. We're going to do some dining. We're going to create some special events. We're going to come together and worship. We're going to create some parties. We're going to try and make things, because I am concerned that those people who came to Atherton never really got to know what Atherton's really all about. And they probably came because of what they thought Atherton was about, and it wasn't Atherton in a pandemic. And so that's the second thing. Third thing, we're going to build a duplex at 719 Irving Street. We're working with the planning, we're working with the city right now. I'm hoping to break ground sometime this summer. We're going to remodel the fitness center. We're going to renovate the villa, although that's going to be in the latter half of 2021. We're going to repaint the administration and skilled nursing center, and actually they're working on that right now. that huge building, which is Fox Hall, all of Fox Hall, Fox 1, Fox 2, all the front, all of Jocelyn, all of that, all the kitchen, all of that gets painted this year. So they have a big job. It's going to take over a month to do it. And we're going to rethink how Atherton deals with pandemics. Because, and what are the role of skilled nursing and assisted living? Because it's a challenge for us. Now, here's the thing that I need to tell you before that. So I have said over and over again that revenue follows occupancy. That if Atherton has good occupancy, it'll have good revenues. That's just the way this works. I need to tell you that except in independent living, the occupancy of skilled nursing and assisted living is down, and it's down significantly. Okay? So here's the thing that I want to tell you. For the last 5 years, we have been working to create a strong rainy day fund, basically. We've been trying to raise our bottom line in a strong and solid way because we thought that one day it would rain. We didn't expect a pandemic. It's now raining. But I will tell you this, even though our occupancy is down, our revenues are strong enough even for us to lose money in 2021 and still have Atherton being solid financially. I am not worried about the financial health. I'm not worried about the future of Atherton because we're in good shape with that. We just have to rethink about how we're going to do some stuff for the future, and we have the ability and the resources to be able to do that. You're going to see that in a couple more weeks when I do the year-end report. But Atherton's in good shape at this point. We have enough resources that we're going to need to be able to make the changes we need to make to go into the next decade of the 21st century. So anyway, thank you very much, and I'm sorry I talked forever. All right, Linda?
All I can say is, wow. I thank you, Bill, and I thank you, Craig. You've given us a lot of information that makes me feel we're really in good hands. Not only Atherton's hand, but God's hands. So thank you very much for all those inspirational thoughts. And I also want to thank Sean and Gary back there, and especially to Casey, who left finally, but we had him in to help us with the technical stuff, and also to Joe for doing the lights and the cameras. I thank you all for tuning in, and if you know people that didn't watch this, please tell them they should go online sometime this week. Would you put it online, the program, Craig? Okay, so you would be able to probably see it on Atherton's Facebook. Next week, I ask you to please watch again. We're going to have a special chapel service, and basically it's to prepare us to think and pray for peace and safety, especially the following day will be the inauguration day. So tune in, and we're really going to turn all these problems over to God. Thank you for coming tonight, and see you next week.